I'd like to take a couple of minutes and address a condition that is being suffered throughout the country by many people. The condition is called tinnitus. Some people pronounce it tinnitus, which equates to essentially ringing sounds and other types of sounds in the ears. Tinnitus is a condition being suffered by many folks. Basically, a sufferer is hearing sounds that are being produced internally without the benefit of an external source. Tinnitus can take many forms, like a roaring noise, crickets chirping, hissing sounds like from an old radiator, for those of you old enough to remember old radiators, clicking, whistling, or ringing sounds. This condition can be constant or intermittent, loud or soft, or variable in all of the above. It can be temporary or permanent and is more often than not associated with hearing loss. Tinnitus in and of itself is not a disease of the ear, but an accompanying symptom of another condition. Estimates from the American Tinnitus Association are that over 50 million people experience tinnitus. 12 million are distraught enough to seek medical attention, and 2 million are actually disabled by it to the point that they can't function during daily activities. So what, if anything, can be done to treat or manage the problem? There's no cure for tinnitus, so the options are limited to managing the problem as best as possible. Tinnitus sufferers with associated hearing loss have found relief in varying degrees from the use of hearing aids. The use of a hearing aid doesn't eliminate the tinnitus, but rather makes the environmental sounds more normal, taking the emphasis off the tinnitus and onto the listening environment. Basically, it's a change in focus for the patient. For persons with tinnitus but without associated hearing loss, there are tinnitus maskers. These devices look like hearing aids but do not amplify the surroundings. These units produce a conflicting noise to the tinnitus called white noise, somewhat like a radio between stations. The white noise cancels out the tinnitus during use. Companies like Oticon, Phonak, Siemens, Resound, Widex, and Microtep typically manufacture these types of products, or at least they used to, at high quality with discretionary considerations. Tinnitus retraining therapy, typically called TRT, involves retraining the mind to focus away from the tinnitus, to essentially remove focus on the noise and refocus to other sounds in the environment. A large percentage of patients have found relief from this methodology. The latest fight in the war on tinnitus is a new treatment called neuromonics. The patient wears a device which is not a hearing aid or a masker, but instead emits music, into which is embedded an acoustic stimulus. At this time, I have no statistics on this process or treatment. For further information, I recommend visiting the American Tinnitus Association at www.ata.org. For those of you lucky enough to be living here with me in South Florida, I have an affiliation with Dr. Paula Liebeskin, who is a tinnitus therapy expert, and who will be very glad to acquire you as a new patient to try to give you some relief from this product. You can please contact me at Discount Hearing Aids of America, Discount Hearing Aids at Comcast.net, and I'll be happy to refer you to Dr. Liebeskin here in Pembroke Pines, Florida. Thank you for watching my video, and please visit my blog. I have a wealth of information there on a lot of variable topics at hearingaidguru.wordpress.com. Thank you.